Welcome, future nurses, to NCLEX Practice Test 28. This is not just another set of questions. This is your chance to push your limits, challenge your thinking, and train your brain, exactly the way the NCLEX will test you on exam day. Before we move to the next question, I want to speak directly to you. Because if you've been studying for NCLEX but still feeling lost, tired, and unsure whether you're on the right path, then listen carefully. After 2 tests more, you will fing you at the another level. This online NCLEX crash course is exactly the missing link you've been searching for. Right. Now, it's available at a massive 70% off, and it's the exact same course that has helped more than 10,000 nursing students pass their NCLEX in just one attempt. You're going to get live interactive classes where your doubts are solved instantly, access to recorded lectures so you can revise anytime, crystal clear PDF notes covering every high yield topic, over 5,000 previously asked NCLEX questions, detailed NGN case discussions, with comprehensive explanations and a step-by-step daily study planner, so you never waste a minute wondering what to read next. This is not just a course, this is a complete NCLEX success system. You've been searching for the right guidance. Here it is. Don't let another exam season pass you by. Click the enrollment link in the description and let's pass NCLEX in one attempt, together. Question 1. Let us begin with an important scenario in infection prevention. Imagine you are a nurse preparing a training session for healthcare staff on ways to prevent the spread of hepatitis C virus in clinical settings. The options are A. Methods for obtaining the hepatitis C vaccine. B. Safe disposal practices for needles and other sharps. C. Proper disposal of urine and stool from patients with HCV. D. Special isolation procedures for individuals with HCV. The topic that should be prioritized for discussion is safe disposal practices for needles and other sharps, which is option B. This is because the most common route of transmission for hepatitis C in healthcare environments is through blood exposure, often caused by accidental needle stick injuries. By ensuring that used needles are placed directly into puncture-proof sharps containers without recapping, healthcare workers significantly reduce the risk of occupational exposure. Educating staff on these strict sharps disposal measures is one of the most effective strategies to protect both healthcare professionals and patients from this infection. Question 2. Consider this scenario from a staff education session on immunizations, where the nurse is discussing inactivated vaccines. The question asks, which statement best describes this type of vaccine? The options are A. It contains a weakened form of the virus. B. It contains a virus that has been killed. C. It contains only a specific fragment of the pathogen. D. It contains a toxin produced by the bacteria. The correct answer is B. It contains a virus that has been killed because inactivated vaccines are made by destroying the virus through physical or chemical means like heat, radiation, or formaldehyde. They cannot replicate inside the body, but they still stimulate immunity. Examples include hepatitis A and inactivated polio vaccines. Option A is incorrect as it describes live attenuated vaccines such as MMR and varicella. Option C refers to subunit or recombinant vaccines like HPV and pneumococcal. Option D refers to toxoid vaccines such as tetanus or diphtheria. Question 3. Moving on, let us work through a fluid intake calculation. A nurse is determining the total intake for a client who has received the following: normal saline at 70 milliliters per hour for 4 hours, 2 cups of ice chips at 8 ounces each, 1 cup of coffee at 8 ounces, and 3 cups of water at 8 ounces each. This is a fill-in-the-blank question, and the correct answer is 1,480 milliliters. Here's how we calculate it. First, for the intravenous fluids, 70 milliliters multiplied by 4 hours equals 280 milliliters. Next, the ice chips. 2 cups at 240 milliliters each gives 480 milliliters. But we only count half, which is 240 milliliters. The coffee adds another 240 milliliters. Finally, the 3 cups of water total 720 milliliters. Adding these together, 280 plus 240 plus 240 plus 720 equals 1,480 milliliters. Clinical Pearl. Remember that 1 cup equals 240 milliliters, only half the volume of ice chips is counted, and total intake includes all oral fluids, intravenous fluids, tube feedings, blood products, and liquid medications, but not pureed foods. Question 4. Now shifting gears to intravenous therapy skills, the question asks, while inserting a peripheral IV catheter into the cephalic vein, at what angle should the nurse align the catheter above the vein? The options are A. 10 to 30 degrees, B. 30 to 45 degrees, C. 45 to 90 degrees, D. 45 to 60 degrees. The correct answer is A. 10 to 30 degrees, as this angle with the bevel up minimizes the risk of puncturing through the vein wall and reduces discomfort. Higher angles, as in options B, C, and D, increase the risk of missing or damaging the vein. Stand-coast pearls. Use the smallest gauge necessary. Choose the non-dominant arm when possible. Consider a BP cuff instead of a tourniquet for fragile skin, and clean the site for at least 30 seconds. Question 5. Turning to pediatrics, we see the question. An infant presents with irritability from acute otitis media. Compared to adults, why are infants at greater risk for this condition? The options are A. Immature cardiac sphincter, B. Feeding in a semi-fowler position, C. Early introduction of solid foods, D. Shorter, narrower, and more horizontal eustachian tubes. The correct answer is D. Shorter, narrower, and more horizontal eustachian tubes, because infant tubes are about 18 millimeters and only angled at 10 degrees, allowing pathogens to travel easily from the nasopharynx to the middle ear. The other options do not contribute to otitis media risk. See the clinical pearls. Risk factors include bottle feeding while lying flat, smoke exposure, and recurrent URIs. Breastfeeding offers antibodies for prevention, and tympanostomy tubes may be used for recurrent cases. Question 6. Next, we consider maternal diet and infant health. The question reads, a breastfeeding mother has an infant diagnosed with lactose intolerance. Which food should she avoid to prevent symptoms in the infant? The options are A. Leafy greens, B. Red meat, C. Ice cream, D. Wheat rolls. The correct answer is C. Ice cream, because it contains lactose that can cause bloating, diarrhea, and fussiness in affected infants. The other options generally do not contain lactose unless prepared with milk. The pearls. Lactose is in all milk products. Mothers can use lactose-free or plant-based alternatives and should ensure adequate calcium and vitamin D intake when avoiding dairy. Question 7. Proceeding now to a medication dosage calculation, let us break this down step by step. We have a client who weighs 92 kilograms and is prescribed intravenous heparin at 12 units per kilogram per hour. The available supply contains 25,000 units in 250 milliliters of D5W. To find the correct infusion rate, we begin by multiplying 12 by 92, which equals 1,104 units per hour. Next, we divide 1,104 by 25,000, then multiply the result by 250. This gives us 11.04 milliliters per hour, which we round to 11 milliliters per hour. Because heparin is a high-alert medication, every calculation must be double-checked by another nurse. Smart infusion pumps should be used for accuracy, and activated partial thromboplastin time, or a PTT, should be monitored regularly. Always watch for any signs of bleeding, such as bruising, hematuria, or gastrointestinal bleeding, and keep protamine sulfate readily available as the antidote in case of overdose. Before we dive into the next question, I need to talk to you. Yes, the future nurse sitting there watching this. I know what you've been going through. The long hours, the constant pressure, the endless doubts in your mind. But here's the truth. You're not alone, and your dream is still very much within reach. Right now, Stancoast Coaching is giving you 70% off our online NCLEX crash course, the exact course that has helped over 10,000 students pass on their very first try. You'll get interactive live classes, recorded lectures you can watch anytime, detailed PDF notes, more than 5,000 NCLEX-style questions, NGN case study discussions, and a daily study plan that tells you exactly what to do. Picture yourself holding your RN or PN license. Imagine the relief, the pride, the joy of telling your family, I passed. That moment can be yours, and it can come sooner than you think. Don't wait another day. Click the link in the description, grab your 70% discount, and let's make your NCLEX success happen together. Question 8. Looking at cardiovascular assessment, the question asks, during a cardiovascular assessment, the nurse listens to the first heart sound S1. Which event is responsible for producing this sound? The options are A. Opening of the mitral and tricuspid valves, B. Closure of the mitral and tricuspid valves, C. Opening of the aortic and pulmonic valves. D. Closure of the aortic and pulmonic valves. The correct answer is B. Closure of the mitral and tricuspid valves, which marks the start of ventricular systole. The other events occur at different phases of the cardiac cycle. Pearls. S1 is best heard at the apex, louder than S2 there, corresponds with the carotid pulse, and is best heard with the diaphragm of the stethoscope. Question 9, we address a critical care scenario. The question asks, after attending a staff education program on disseminated intravascular coagulation, DIC, which client is at highest risk? The options are A. Iron deficiency anemia on IV iron. B. Gram-negative sepsis on IV antibiotics. C. Atrial fibrillation on rivaroxaban. D. Aspirin daily for ACS prevention. The correct answer is B. Gram-negative sepsis on IV antibiotics, as endotoxins from gram-negative bacteria can activate the clotting cascade excessively. The other options do not directly cause DIC. Here, the pearls. DIC can result from sepsis, obstetric complications, trauma, or cancer. Early signs include oozing from IV sites. Late signs include organ ischemia. Labs show low platelets, low fibrinogen, prolonged PT/PTT, and high D-dimer. Treatment targets the underlying cause and may require blood product replacement. Question 10. Continuing with an important anticoagulation scenario, a client hospitalized for venous thromboembolism develops heparin-induced thrombocytopenia, HIT. The heparin infusion is stopped right away, and the question asks, which new prescription is the nurse most likely to receive from the healthcare provider to continue anticoagulation therapy? The options are A. Enoxaparin, B. Dabigatran, C. Ketorolac, D. Epoetin alpha. The correct answer is B. Dabigatran, because HIT is an immune-mediated reaction that drastically reduces platelet counts and increases clotting risk. Once heparin is stopped, a non-heparin anticoagulant such as dabigatran, apixaban, or rivaroxaban should be started. Option A is incorrect, because enoxaparin is a low molecular weight heparin and could trigger the same reaction. Option C is an NSAID used for pain, not clot prevention. Option D stimulates red blood cell production and is unrelated to HIT management. Question 11. Shifting our attention to prenatal care. During a routine prenatal checkup, the healthcare provider requests a urine sample. The question asks, which of the following is not typically assessed using this specimen? The options are A. Ketones, B. Sexually transmitted infections, C. Glucose, D. Testosterone levels. The correct answer is D. Testosterone levels, because testosterone is not part of routine urinalysis and, if needed, is measured via blood testing. Option A is correct in real-life practice because ketones may indicate poor carbohydrate intake or uncontrolled diabetes. Option B is valid because urine can detect STIs such as chlamydia or gonorrhea. Option C is relevant because urine glucose monitoring can help detect gestational diabetes. Question 12. Now turning to a neurotrauma case, a patient sustains a complete spinal cord injury at the L3 vertebral level after a motor vehicle accident. The question asks, which body area will most likely have a loss of voluntary motor movement? The options are A. Abdomen, B. Arms, C. Legs, D. Chest. The correct answer is C. Legs because lumbar spinal nerves control motor function in the lower extremities. So, damage at L3 impairs leg movement while sparing upper body control. Option A is incorrect because abdominal muscles are controlled by T9 to T12. Option B is incorrect because arm function involves C5 to T1. Option D is incorrect because the chest is innervated by T1 to T8. Question 13. Switching now to a pediatric dosage calculation, let us look at this example. A child weighing 13 kilograms is prescribed vancomycin at 50 milligrams per kilogram per day, divided into 3 equal doses. The supply available is 500 milligrams in 100 milliliters of normal saline. To work out how much should be given for each dose, we start with step 1. Multiply 50 by 13 to get a total daily dose of 650 milligrams. Step 2. Divide that daily total into 3 doses, giving 216.66 milligrams per dose. Step 3. Use the concentration to find the volume, 216.66 divided by 500, then multiplied by 100. which equals 43.32 milliliters. Step 4. Round to the nearest whole number, which gives us 43 milliliters per dose. Vancomycin is used for serious gram-positive infections, including MRSA. It should always be infused slowly to prevent red man syndrome. Trough levels should be monitored to ensure therapeutic dosing, and intravenous sites must be checked often for signs of phlebitis or infiltration. Question 15. In another clinical teaching moment, a client is prescribed a high-potency topical corticosteroid lotion. The question is, which body area should the nurse instruct the client to avoid applying this medication to? The options are A. Feet, B. Face, C. Outer thigh, D. Abdomen. The correct answer is B. Face, because high-potency steroids can cause skin thinning and pigment changes on delicate facial skin. Option A, C, and D may tolerate short-term use when prescribed, but prolonged use in any location increases side effect risk. C. The pearls. Avoid high-potency steroids on thin or sensitive skin such as the face, groin, and axillae. Use the lowest effective potency. Apply after bathing for best absorption and limit duration to prevent side effects. Question 16. Looking at mental health communication, the question says, a client explains, I missed my last doctor's appointment because I overslept, but it would not have helped anyway. Which defense mechanism does this illustrate? The options are A. Projection, B. Reaction formation, C. Denial, D. Rationalization. The correct answer is D. Rationalization, because the client is justifying the missed appointment with a socially acceptable explanation rather than accepting responsibility. Option A. Projection is blaming others for one's own feelings. Option B, reaction formation, is acting opposite to one's true feelings. Option C, denial, is refusing to acknowledge reality. Pearls. Defense mechanisms protect from anxiety but can be maladaptive. Rationalization is common and may mask deeper concerns. Nurses should recognize these patterns and support healthier coping strategies. Question 17. Finally, in a teaching session on seizure types, the nurse is asked, how should a complex partial seizure be described? The options are A. An episode that can cause impaired awareness or fainting, typically lasting 1 to 3 minutes. B. A seizure in which the person remains fully conscious the entire time. C. A brief loss of muscle tone for seconds, followed by confusion. D. Sudden brief muscle jerks that may occur singly or in clusters. The correct answer is A. An episode that can cause impaired awareness or fainting, typically lasting 1 to 3 minutes, because complex partial seizures, focal impaired awareness seizures, involve altered consciousness and often automatisms like lip smacking or clothing picking. Option B describes simple partial seizures, Option C describes atonic seizures, and Option D describes myoclonic seizures. The pearls. Complex partial seizures start in one brain area, but impair consciousness. Automatisms are common, postictal confusion is typical, and treatment may involve anti-epileptic drugs such as carbamazepine. Safety measures are essential during and after an episode. Question 18. Let us begin with an acute mental health scenario. In the emergency department, a client presents with severe anxiety, and the question asks, which assessment finding would the nurse most likely observe? The options are A. Reduced attention span but able to problem solve with assistance. B. Increased awareness of surroundings and recognition of anxiety. C. Narrowed focus but able to discuss coping strategies. D. Inability to problem solve accompanied by a sense of impending doom. The correct answer is D. Inability to problem solve accompanied by a sense of impending doom, because severe anxiety drastically reduces the perceptual field, scatters attention, and prevents effective problem solving. The person may fixate on one detail, struggle to learn, and feel something catastrophic is about to happen. Option A occurs in moderate anxiety. Option B describes mild anxiety, and Option C aligns with moderate but not severe anxiety. Question 19. Next, we consider safe medication use. A client is prescribed tiotropium bromide inhalation capsules, and the question asks, which client action would be a significant safety concern? The options are A. Throwing unused capsules in household trash. B. Giving the medication to a family member with COPD. C. Using the inhaler while lying in bed. D. Keeping the medication in its original blister pack in a dry, cool place. The correct answer is B. giving the medication to a family member with COPD because prescriptions should never be shared. Doing so risks incorrect dosing, unexpected side effects, and legal consequences. Option A is acceptable if trash is secured. Option C may reduce efficiency but is not dangerous. And option D is correct storage practice. Pearls. Tiotropium is a long-acting bronchodilator for COPD maintenance. Side effects include dry mouth and cough. Sharing medications increases misuse risks. Store capsules properly until use. Question 20. Moving on to pain assessment, the question states, a client reports pain as 1 on a 0 to 10 scale, but the nurse notices grimacing with every movement. What is the nurse's best initial action? The options are A. Provide pain medication immediately. Begin to other patient assignments. C. Ask the client about the observed grimacing. D. Offer distraction by suggesting TV or activities. The correct answer is C. Ask the client about the observed grimacing because differences between reported pain and nonverbal cues must be clarified before intervening. Option A could lead to unnecessary or insufficient treatment. Option B ignores the issue, and option D skips the essential assessment step. Pearls. Assess pain using both verbal and nonverbal indicators. Cultural factors may lead to underreporting. Always address inconsistencies before planning care. Question 21. Turning now to emergency care, a client arrives with acute vertigo. The question asks, which nursing intervention should take priority? The options are A. Advise the client to avoid sudden or jerky movements. B. Request a prescription for an antihistamine. C. Raise the upper side rails of the bed. D. Assess for the presence of nausea and vomiting. The correct answer is C. Raise the upper side rails of the bed because vertigo significantly increases fall risk, making safety precautions the top priority. Option A is useful teaching but not urgent. Option B addresses symptoms but not immediate danger. And option D is secondary to preventing injury. The pearls. Vertigo causes imbalance and disorientation. Safety measures include side rails up, call bell within reach, and assistance with ambulation. Avoid sudden head movements and bright lights. Question 22. Considering pediatric safety, the question is, which child is at greatest risk for choking or suffocation? The options are A. A toddler playing with small pieces from an older sibling's construction set. B. A 5-year-old eating a yogurt snack. C. An infant sleeping in a crib without bedding. D. A 3-year-old drinking a glass of juice. The correct answer is A. A toddler playing with small pieces from an older sibling's construction set because toddlers explore objects orally, making small toy parts a major hazard. Option B involves a low-risk food. Option C describes a safe crib setup. And option D is generally safe with supervision. The pearls. Children under 4 have immature chewing and swallowing skills. Avoid small, hard foods and keep tiny objects out of reach. Safe sleep means no pillows, blankets, or stuffed toys in the crib. Question 23. Shifting to obstetric emergencies, the question asks, a client is suspected of having an ectopic pregnancy. Which diagnostic test should the nurse expect? The options are A. Non-stress test. B. Abdominal X-ray. C. Transvaginal ultrasound. D. Doppler for fetal heart tones. The correct answer is C. Transvaginal ultrasound because it visualizes early gestational structures and determines implantation site. Option A is for late pregnancy fetal monitoring. Option B is inappropriate and exposes radiation. And option D cannot locate implantation. Points to remember. Ectopic pregnancies usually occur in the fallopian tube, causing pelvic pain and bleeding. Risk of rupture demands urgent care. Stable cases may get methotrexate. Unstable cases need surgery. Question 24. In this fluid therapy scenario, we have a client with severe hypovolemia who is prescribed 2,350 milliliters of normal saline to be infused over 5 hours. The question is, what should the infusion rate be in milliliters per hour? To solve this, we divide the total volume by the total time, 2,350 divided by 5, which gives us 470 milliliters per hour. That is the correct infusion rate. Now, for the Stankos pearls, remember the simple formula. Volume divided by time equals the infusion rate. Always monitor for signs of fluid overload, especially in clients with underlying cardiac conditions. In cases of hypovolemia, Frequent monitoring of vital signs and urine output is essential to ensure the patient is responding well to therapy. Question 25. Looking at seizure recognition, the question asks, a client has a sudden, brief loss of muscle tone for seconds causing collapse. Which seizure type is this? The options are A. Atonic seizure, B. Tonic-clonic seizure, C. Absence seizure, D. Complex partial seizure. The correct answer is A. Atonic seizure because these drop attacks cause abrupt loss of tone, risking injury. Option B has stiffening, then jerking. Option C has staring spells. And option D affects awareness with automatisms. Points to remember. Atonic seizures may require helmet use, often part of Lennox-Gastaut syndrome, and respond to meds like valproate or lamotrigine. Hold on. Before we continue, I want you to hear this. If you're watching this, I know the NCLEX matters to you. I know you've been studying hard, fighting through stress, and wondering if you can really do it. Let me tell you, you absolutely can, and I'm here to make sure of it. We're offering a limited-time 70% discount on our complete online NCLEX crash course, the same one that's guided thousands of students to pass on their very first attempt. Inside, you'll find daily live sessions to clear your doubts, instant replay recordings, in-depth notes, thousands of practice questions, and the Nigerian Naira training you need to crush the exam. Close your eyes and imagine logging in to see your PASS result. Imagine calling your parents, your partner, your friends with the news. That's the future you've been working for, and it's closer than you think. Don't let this opportunity pass you by. Enroll today using the link below and lock in your 70% discount before it's gone. Question 26. Turning to pharmacology, the question says, a patient is receiving norepinephrine. Which statement best describes its mechanism? The options are A. Acts mainly in the brain to regulate emotions. B. Produced by adrenal cortex to control heart rate and blood pressure. C. Released from sympathetic nerve endings and works via adrenergic receptors. D. Secreted by posterior pituitary to maintain fluid balance. The correct answer is C. Released from sympathetic nerve endings and works via adrenergic receptors, causing vasoconstriction and increased contractility. Option A refers to CNS effects. Option B misstates its source, adrenal medulla, and option D describes ADH. Points to remember. Norepinephrine is a first-line vasopressor in septic shock. Monitor BP continuously and watch for extravasation. Treat with phentolamine if it occurs. Question 27. Finally, in an airway emergency, the question is, before endotracheal intubation, which drug is most likely ordered for sedation? The options are A. Propofol, B. Baclofen, C. Phenytoin, D. Haloperidol. The correct answer is A. Propofol because it is a rapid-acting sedative hypnotic used to induce anesthesia or deep sedation before procedures. Option B is a muscle relaxant for spasticity. Option C is an anticonvulsant, and option D is an antipsychotic. Propofol works within seconds, is given before neuromuscular blockers, and requires close monitoring for hypotension and respiratory depression. Question 28. Let us now turn to cardiac diagnostics. A client admitted with suspected myocardial infarction needs lab testing, and you must pick the most sensitive and specific indicator of myocardial injury. The options are A. Creatine phosphokinase, MB, CKMB, B. Troponin, I, C. Creatine kinase, CK, or D. Myoglobin. The correct answer is option B, troponin I. Troponin I is highly specific for myocardial injury, rises within 3 hours of damage, and remains elevated for 7 to 10 days, making it useful even if the client presents days after onset. Option A, CKMB, is cardiac specific but less sensitive and normalizes faster. Option C, CK, is found in multiple tissues and lacks specificity. Option D, myoglobin, rises quickly, but is nonspecific as it increases with any muscle injury. Question 29. Shifting focus to trauma assessment, a 24-year-old woman presents to the emergency department with bilateral periorbital bruising, raccoon eyes, appearing a few days after head injury. Which diagnosis does this most strongly suggest? The options are A. Cerebrospinal fluid leak, B. Basilar skull fracture, C. Brown-Séquard syndrome, or D. subarachnoid hemorrhage. The correct answer is option B, basilar skull fracture. Raccoon eyes are a hallmark sign, especially when the anterior cranial fossa is involved. Other signs include Battle's sign and hemotympanum. typically appearing 1 to 3 days after injury. Option A, cerebrospinal fluid leak, may result from the fracture but presents as clear drainage, not bruising. Option C, Brown-Séquard syndrome, involves spinal cord injury symptoms rather than facial bruising. Option D, subarachnoid hemorrhage, presents with severe headache and neurological symptoms, not raccoon eyes. Question 30. Now consider a medication timing question. A client receives subcutaneous injections of both regular insulin and NPH insulin at 800 hours. When should the nurse first check for hypoglycemia? The choices are A. 830, B. 1000, C. 1200, or D. 1400. The correct answer is option B. 1000. Regular insulin peaks 2 to 4 hours after administration, so 1000 marks the start of its peak effect and the highest risk for hypoglycemia. Option A is too soon, as insulin has just begun to act. Option C is too late, and option D misses the early hypoglycemia window. Question 32. Shifting into endocrine care, a client with Graves's disease is being instructed on self-care. Which advice is most important for the nurse to emphasize? The options are A. Use daily stool softeners to prevent constipation. B. Take thyroid replacement in the morning. C. Report significant weight gain while on antithyroid therapy. Or D. Restrict fluids to prevent overload. The correct answer is option C. Report significant weight gain while on antithyroid therapy. This could signal overtreatment leading to hypothyroidism. Option A relates more to hypothyroidism. Option B applies to hypothyroid patients. And option D is not part of typical Graves management. Question 33. Moving to injection safety. During an intramuscular injection teaching session, which statement indicates correct understanding? The options are A. For older infants and small children, give no more than 1 milliliter per site. B. Push the plunger while inserting the needle. C. Insert at about a 60-degree angle. Or D. Ventrogluteal muscle is more painful than vastus lateralis. The correct answer is option A. This volume limit avoids tissue damage and ensures absorption. Option B risks subcutaneous injection. Option C uses the wrong angle. IM requires 90 degrees. And option D is incorrect because ventrogluteal is usually less painful. Question 34. In another urgent care example, a client arrives with fever, neck stiffness, and irritability. What is the nurse's first action? The options are A. Administer ibuprofen. B. Initiate droplet precautions. C. Notify public health. Or D. Collect blood cultures. The correct answer is option B. Initiate droplet precautions. This presentation suggests bacterial meningitis, and preventing spread is the priority before other steps. Option A treats symptoms but not transmission. Option C and D follow after isolation. Bacterial meningitis can be fatal quickly. Isolation measures include a private room, surgical mask use, and limiting transport. Classic triad is fever, nuchal rigidity, and altered mental status. Question 35. Let us address discharge planning. Which client needs the most urgent referral to community-based support services? The options are A. Client with skin cancer living with family. B. Stroke patient going to inpatient rehab. C. Homeless client with substance use disorder. Or D. Client leaving against advice after cellulitis treatment. The correct answer is option C. Homeless client with substance use disorder. This group faces extreme barriers to care, adherence, and recovery, making community support vital. Option A has family support. Option B already has rehab placement. And option D's situation does not necessarily require such referrals. Question 36. In respiratory assessment, which student nurse statement needs correction? A. Wheezes originate from small airways and generally do not clear after coughing. B. A pleural friction rub sounds loud and scratchy, usually during inspiration. C. Thick, sticky mucus that clears with coughing causes crackles. Or D. Fluid or mucus in large airways can produce coarse crackles. The correct answer is option C. Thick mucus that clears with coughing produces rhonchi, not crackles, which are caused by air moving through fluid-filled or collapsed alveoli, and usually do not clear. Option A correctly describes wheezes. Option B correctly describes pleural friction rubs, and option D is accurate for coarse crackles. Wheezes, narrowed airways. Pleural friction rub, pleural inflammation. coarse crackles, Tonran, large airway secretions. Raunchy, Harn, low-pitched, clear with cough, fine crackles. Small airway popping sound. Question 37. Stepping into the realm of infection control and isolation precautions, imagine there is only one private hospital room available, and you must decide which patient will be assigned to it. The choices are A, a patient with HIV infection, B, a patient experiencing delirium tremens with agitation, C, a patient with disseminated herpes zoster, or D, a patient with an accessed implanted port. The correct answer is option C, a patient with disseminated herpes zoster. This form of shingles is contagious through both airborne and contact routes until all lesions have crusted. Housing the patient in a private negative pressure room prevents respiratory and direct contact spread. Option A is incorrect because HIV requires only standard precautions unless another infectious process is present. Option B is not correct since delirium tremens may require a calm environment but not isolation. Option D is also incorrect because an accessed implanted port alone does not require isolation unless infection is suspected. Question 38. Shifting our focus to electrolyte imbalances. Consider a patient with severe hypernatremia. Which assessment should be the nurse's top priority? The options are A, cardiovascular assessment, B, genitourinary assessment, C, neurological assessment, or D, gastrointestinal assessment. The correct answer is option C, neurological assessment. Sodium plays a vital role in nerve conduction, and severe hypernatremia can cause restlessness, confusion, seizures, and coma. Monitoring neurological status allows rapid recognition and treatment of life-threatening complications. Option A, while important, is not the primary concern in hypernatremia. Option B is less critical, except when fluid balance changes are involved. Option D is incorrect as gastrointestinal effects are not the main issue in sodium excess pearls. The normal sodium range is 135 to 145 milliequivalent per liter, with levels above 160 milliequivalent per liter being potentially fatal. Common causes include dehydration, excessive sodium intake, and diabetes insipidus. Key warning signs are confusion, seizures, and altered mental status. Correct sodium gradually to avoid cerebral edema. Question 39. Now let us look at pediatric respiratory care. A child hospitalized earlier for a severe asthma attack is preparing to sleep. Which position should be recommended to reduce the risk of nighttime breathing difficulty? The options are A, high or semi-Fowler's position, B, prone position, C, side-lying position, or D, supine position. The correct answer is option A, high or semi-Fowler's position. This elevation supports lung expansion, improves airflow, and reduces the chance of nocturnal bronchospasm. Option B, prone, can restrict chest expansion. Option C, side-lying, may compress one lung and narrow airways during sleep. Option D, supine, may worsen symptoms by aggravating reflux or contributing to airway obstruction. Question 40. Let us turn to musculoskeletal infection. During an educational session on acute osteomyelitis, which statement reflects accurate knowledge? The options are A, intravenous antibiotics are usually given for about 1 to 2 weeks. B, viruses are the most common cause of acute osteomyelitis. C, high fever, often above 101 degrees Fahrenheit, 38.3 degrees Celsius, is common, or D, petechiae are typically seen on the affected limb. The correct answer is option C, high fever is common. Acute osteomyelitis often presents with localized bone pain, swelling, and a significant fever. Option A is incorrect because treatment requires 6 to 12 weeks of intravenous antibiotics. Option B is incorrect because the most common cause is bacterial, particularly Staphylococcus aureus. Option D is wrong because petechiae are more typical of fat embolism or certain hematologic disorders. Pearls. Osteomyelitis may follow fractures, surgery, or spread from local infections. MRI is highly sensitive for early diagnosis. Timely and prolonged antibiotic therapy is essential to prevent bone destruction and chronic infection. Question 41. Let us revisit infection control in pediatric care. A child presents with fever, neck stiffness, photophobia, and a rash. Which action should be the nurse's immediate priority? The options are A, give a tepid sponge bath, B, start droplet precautions, C, prepare for lumbar puncture, or D, arrange a brain CT scan. The correct answer is option B, start droplet precautions. These symptoms strongly suggest meningitis, which can be bacterial and highly contagious. Placing the patient on droplet precautions immediately prevents spread before proceeding to diagnostics. Option A addresses comfort but not infection control. Option C is essential for confirmation, but must follow isolation. Option D may be needed later, but is not the first step. Question 42. Moving into immunization principles, a nurse attending an in-service on vaccines is asked which statement shows correct understanding. The options are A. The measles, mumps, and rubella, MMR, vaccine is a live attenuated vaccine. B. Some vaccines can be mixed together in one syringe. C. The dorsogluteal site is acceptable for intramuscular vaccines. Or D. There must be a 2-week gap before giving another vaccine. The correct answer is option A. MMR is a live attenuated vaccine containing a weakened form of the virus that stimulates a strong immune response without causing full disease in healthy individuals. It is contraindicated in pregnancy and immunocompromised clients. Option B is wrong because vaccines are never mixed unless pre-formulated together. Option C is avoided due to sciatic nerve injury risk, and option D is incorrect since 2 live attenuated vaccines can be given the same day or separated by 4 weeks. Pearls. Live attenuated vaccines mimic natural infection but require caution. Give combination products only when manufactured that way. Choose safe IM sites. Remember, same day or 4 weeks for 2 live attenuated doses. Question 43. Shifting to emergency prioritization, after an industrial accident, the nurse must decide who needs immediate follow-up. The options are A. Fracture with increasing pain, B. Crying because they cannot find their child, C. Singed eyebrows and hoarse voice, or D. Diabetic who lost their insulin pump. The correct answer is option C. Singed nasal hairs, facial burns, and hoarseness indicate possible inhalation injury, which can cause airway swelling and rapid obstruction. Early airway management is critical before swelling worsens. Option A is painful but not immediately life-threatening if circulation is intact. Option B is emotional distress, and option D is important but not an immediate airway emergency. Pearls. Always follow ABCs. Airway burns need rapid evaluation and possible early intubation. A hoarse voice after smoke exposure is a red flag for impending obstruction. Question 44. In the realm of psychosocial care, a nurse wants to assess a client's spirituality. The options are A. What are your sources of hope and strength? B. Have you arranged a church visit? C. Do you attend worship on a specific day? Or D. Do you have dietary restrictions? The correct answer is option A. This open-ended question invites the client to share personal beliefs and coping mechanisms without assuming a religious framework. Option B and C assume religious affiliation, while option D may reflect dietary or religious rules, but does not directly assess spirituality. Stand coast, pearls. Use open, non-judgmental questions. Recognize spirituality's influence on recovery and coping. Distinguish structured religion from personal meaning. Question 45. Moving to pharmacology safety. A client taking digoxin and furosemide presents with certain symptoms. Which finding needs urgent follow-up? The options are A. Night sweats and headache, B. Vomiting and halos around lights, C. Fatigue and dry skin, or D. Low blood pressure and dark urine. The correct answer is option B. Nausea, vomiting, and visual halos are classic signs of digoxin toxicity, which is more likely with hypokalemia caused by loop diuretics like furosemide. Option A and C are nonspecific, and option D may indicate other issues, but is not specific for digoxin toxicity. Pearls. Monitor potassium closely. Hypokalemia increases digoxin toxicity risk. Check apical pulse before dosing. Teach patients to report visual changes or irregular heartbeat promptly. Wait just a second. I need to speak directly to you before we go further. You've been putting in the work, you've been pushing yourself, but sometimes it still feels impossible. I get it. I've seen so many students feel that way. Right before they passed on their first attempt. Right now, we're giving you 70% off our online NCLEX crash course. That means you get live classes, on-demand recordings, step-by-step notes, more than 5,000 practice questions, and NGN case discussions that prepare you for the toughest scenarios. plus a daily plan that removes all the guesswork from your preparation. Imagine this. A few weeks from now, you're looking at your result, and the word pass is staring back at you. That moment of relief, the pride in your family's eyes. That's what this is about. Don't let hesitation cost you your dream. Click the enrollment link now, grab your 70% discount, and let's get you that license. Question 46. In acute heart failure management, a patient with dyspnea, bilateral crackles, weak pulses, and frothy pink sputum is admitted. Which order should be questioned? The options are A. Oxygen via nasal cannula, B. Losartan, C. Fowler's position, or D. Diltiazem. The correct answer is option D. Diltiazem is a calcium channel blocker with negative inotropic effects that can worsen systolic dysfunction in acute decompensated heart failure. Option A improves oxygenation, option B reduces afterload, and option C optimizes lung expansion. Pearls. In acute heart failure, reduce preload, lower afterload, improve oxygenation, and avoid drugs that depress contractility. Pink frothy sputum is a hallmark of pulmonary edema and requires immediate intervention. Question 47. When caring for a client admitted with anorexia nervosa, the nurse must identify the priority goal. The options are A. Attending scheduled group therapy, B. Adhering to the medication regimen, C. Gaining 1 pound, 0.5 kilogram a week, or D. Demonstrating increased self-esteem. The correct answer is option C. In anorexia nervosa, restoring nutritional health takes precedence because malnutrition can lead to electrolyte disturbances, cardiac arrhythmias, and multi-organ failure. A steady gain of about 1 pound per week is a safe, evidence-based approach that helps avoid refeeding syndrome. Option A and D are important for long-term recovery, but are not immediate survival priorities. And option B is less relevant because no medication directly cures anorexia. Pearls. Address malnutrition first, correct electrolyte imbalances, monitor cardiac status during refeeding, and once stable, progress to psychological and behavioral interventions. Question 48. In a client with hyponatremia due to dehydration, which finding would the nurse expect? The options are A. Orthostatic hypotension, B. Peaked T waves on ECG, C. Bounding peripheral pulses, or D. Polyuria. The correct answer is option A. Low circulating volume from dehydration leads to orthostatic hypotension because reduced venous return limits cardiac output on standing. Option B is specific to hyperkalemia. Option C occurs in fluid overload. And option D is typical of conditions like diabetes mellitus or diabetes insipidus rather than dehydration-related hyponatremia. Points to bear: remember. Hyponatremia with hypovolemia puts the brain at risk for swelling. Correct sodium slowly to avoid osmotic demyelination, and assess for physical signs like poor skin turgor and dry mucous membranes. Moving to question 49. A child with croup has worsening inspiratory stridor and oxygen saturation of 92% on room air. Which medication should be obtained? The options are A. Formoterol via dry powder inhaler, B. Nebulized racemic epinephrine, C. Albuterol via nebulizer, or D. Oral montelukast. The correct answer is option B. Racemic epinephrine rapidly reduces upper airway swelling via alpha-adrenergic vasoconstriction, improving oxygenation in moderate to severe croup. Option A is a maintenance drug for asthma. Option C targets lower airway bronchospasm. And option D is for chronic asthma or allergy prevention, not acute airway swelling. See Stancoast. Pearls. Croup presents with barking cough, hoarseness, and stridor. Keep the child calm, use humidified oxygen, administer racemic epinephrine and corticosteroids, and monitor for rebound swelling after treatment. Switching to question 50. When teaching about hydrochlorothiazide, HCTZ, which statement shows correct understanding? The options are A. I should be cautious about prolonged sun exposure. B. I may feel sedated due to HCTZ's central nervous system depressant effect. C. HCTZ can cause hypocalcemia, so I need more calcium. Or D. I might lose my sense of taste. The correct answer is option A. HCTZ can cause photosensitivity, so patients should use sun protection. Option B is incorrect because sedation is not typical. Option C is wrong, since thiazides actually decrease urinary calcium excretion. And option D is incorrect because it is not a correct statement associated with ACE inhibitors. Points to remember. Monitor potassium to prevent hypokalemia. Watch uric acid levels in gout patients. Take in the morning to avoid nocturia. And remember, it lowers blood pressure by decreasing preload and peripheral resistance. Moving to question 51, starting with electrolyte physiology, the nurse must identify the electrolyte correctly paired with one of its functions. The options are A. Sodium, maintains circulating blood volume and supports nerve impulse transmission. B. Bicarbonate, controls extracellular fluid balance. C. Chloride, regulates plasma protein concentration. Or D. Calcium, metabolizes fats, carbohydrates, and proteins. The correct answer is option A. Sodium is the principal extracellular cation responsible for osmotic pressure, fluid balance, and blood volume, as well as nerve conduction and muscle contraction. Bicarbonate's main role is acid-base buffering, chloride assists with osmotic pressure and acid-base balance, and calcium is key for clotting and bone health, but not macronutrient metabolism. Points to remember. Think sodium sets the stage for circulation. Without it, both fluid balance and nerve signaling fail. See the question. 52. Moving to neurological emergencies. A client with traumatic brain injury and cerebral edema requires a medication to reduce intracranial pressure. The options are A. Mannitol, B. Hydrochlorothiazide, C. Spironolactone, or D. Furosemide. The correct answer is option A. Mannitol, an osmotic diuretic, draws fluid from swollen brain tissue into the intravascular space, lowering intracranial pressure without crossing the blood-brain barrier. It must be infused with a filter and monitored closely for fluid overload. The other diuretics listed are less effective or inappropriate for rapid ICP reduction. Points to remember. Mannitol makes the brain lighter. It's the go-to for acute, dangerous ICP spikes. Here is the next one. Question 53. In tracheostomy care, the nurse must ensure a critical item is at the bedside for emergency airway management. The options are A. Air humidifier, B. Spare inner cannula, C. Nasal cannula oxygen, or D. Tracheostomy brush. The correct answer is option B. A sterile spare inner cannula restores airway patency immediately if the current one becomes blocked with mucus. Humidifiers help secretion management but are not life-saving. Nasal cannulas bypass the tract site, and brushes are for routine cleaning only. See the Stancoast pearls. For a blocked tract, think swap, not struggle. Always have the spare ready. See the question. 54. Before thyroidectomy, a hyperthyroid patient is prescribed potassium iodide. The options are A. Reduce the risk of a granulocytosis, B. Prevent postoperative hypocalcemia, C. Shrink and reduce blood flow to the thyroid gland, or D. Lower postoperative blood glucose. The correct answer is option C. Potassium iodide reduces thyroid size and vascularity, lowering intraoperative bleeding risk. It does not prevent a granulocytosis, treat hypocalcemia, or affect glucose. Points to remember. Iodine before incision. Calmer gland, safer surgery. Question 55. Shifting our focus to dosage calculation, let us work through this heparin infusion example step by step. A client is prescribed heparin at 60 units per kilogram per hour, weighs 85 kilograms, and the available supply is 25,000 units in 250 milliliters of solution. To find the correct infusion rate, we start by multiplying 60 by 85, which equals 5,100 units per hour. Next, we divide 5,100 by 25,000 and then multiply by 250. This gives us an infusion rate of 51 milliliters per hour. Because heparin is a high-alert medication, every dose calculation should be verified by a second nurse, and activated partial thromboplastin time, or a PTT levels, must be monitored closely to ensure the drug is within the therapeutic range. And remember this key point. With heparin, math is life-saving math. Precision here is not just a number on paper. It is the difference between preventing dangerous clots and avoiding catastrophic bleeding. Question 56-. In a prioritization scenario, which client needs the most urgent follow-up? The options are A. Chest tube patient with redness, B. Ulcerative colitis patient with 3 bloody stools in an hour, C. Concussion patient with headache rated 4 out of 10, or D. Ischemic stroke patient with blood pressure of 100 over 58 millimeters of mercury. The correct answer is option D. In ischemic stroke, adequate cerebral perfusion depends on maintaining higher than normal blood pressure. A low reading risks worsening ischemia. The other cases are important but not immediately life-threatening. Points to be remembered. In stroke care, low pressure means low perfusion. Without pressure, the brain starves. Let us move our attention to question 57. In a hospital, introducing a new patient assignment method, the nurse manager's best first action to reduce staff resistance is being considered. The options are A. Offer incentives to encourage adaptation. B. Give staff a platform to share and discuss worries. C. Present numerical data supporting the change. Or D. Create a multimedia presentation about the changes. The correct answer is option B. Open forums where staff can express concerns and ask questions, address emotional resistance, and build trust. Incentives, option A, may motivate but do not resolve fears. Data, option C, alone, rarely change attitudes. And presentations, option D, are one-way communication without feedback. Points to be remembered. In change management, two-way communication early in the process improves cooperation and reduces resistance. Here is next scenario. Question 58. In an oncology unit, the nurse must identify which client requires immediate attention. The options are A. Client on chemotherapy via PICC line reporting blistering at the site. B. Client receiving chemotherapy, infusion with nausea and vomiting. C. Client on oral chemotherapy with mouth pain after orange juice. Or D. Client on external beam radiation therapy waiting with family. The correct answer is option A. Blistering or burning at a vascular access site during chemotherapy suggests extravasation, which can cause severe tissue damage and must be managed immediately. The other options describe expected or less urgent effects. Points to be remembered. Always stop chemotherapy immediately if extravasation is suspected and follow institutional protocols to limit tissue injury. Continuing with question 59, a 4-year-old with fever, rash, red swollen hands and feet, and lymphadenopathy is suspected of having Kawasaki disease. Which assessment best supports the diagnosis? The options are A. Listen to heart sounds. B. Check capillary refill. C. Measure blood pressure. Or D. Inspect oral mucosa. The correct answer is option D. Strawberry tongue, cracked lips, and oral erythema are hallmark features of Kawasaki disease and help confirm diagnosis for urgent treatment. The other assessments are important but not primary diagnostic indicators. Points to be remembered. Kawasaki diagnosis requires fever plus at least 4 of 5 classic signs. Early treatment with IVIG reduces coronary artery aneurysm risk. See the next question 60. For a client with a BMI of 17, which diet should be recommended? The options are A. Fat-restricted diet. B. Low-protein diet. C. High-caloric diet. Or D. Low-sodium diet. The correct answer is option C. A high-calorie diet with adequate protein and healthy fats supports gradual weight gain to restore BMI to the healthy range. The other diets unnecessarily restrict needed nutrients. Points to be remembered. Underweight clients require high-calorie, high-protein diets unless contraindicated, with careful monitoring to avoid refeeding syndrome. Before we tackle the next question, I want to tell you something important. You've been preparing, you've been sacrificing time, energy, and maybe even sleep, because this exam matters. I see that. And I want to make sure all that effort pays off. We're offering a massive 70% discount on our complete online NCLEX crash course. And this is the exact system that's taken thousands of nursing students from stressed and unsure to confident and successful on their first attempt. You'll get live classes, lifetime access to replays, concise and detailed PDF notes, over 5,000 NCLEX-style practice questions, NGN case study sessions, and a study plan that works even if you're busy. Think ahead. You're standing there, result in hand with pass printed on it. That's not just a dream. That can be your reality if you take the step now. Click the link below, secure your 70% discount, and let's make sure you pass NCLEX in one attempt together. Here is question 61. While caring for a prostate cancer client undergoing brachytherapy, the wife asks to extend her visit. The options are A. The hospital does not allow extended visits. B. You should not stay longer than necessary. C. Your husband will sleep better if you go home. Or D. You need to limit your stay to protect yourself from radiation. The correct answer is option D. Radiation safety for visitors includes limiting time, keeping distance, and avoiding exposure for pregnant women and children. The other responses do not explain the actual risk. Here is our cynical pearls. Teach visitors time-distance shielding rules to reduce radiation exposure. Moving to question 62. A client with breast cancer asks for resources to help cope. The options are A. Reviewing breast cancer risk factors with family. B. Assessing the unaffected breast for abnormalities. C. Advising daughter to consider BRCA testing. Or D. Joining a breast cancer support group. The correct answer is option D. Support groups are tertiary prevention, aimed at improving quality of life and coping after diagnosis. The other options are examples of primary or secondary prevention. See the Stancoast Pearls. In prevention stages, tertiary care focuses on living well with illness and preventing further complications. Let's us shift to question 63. While teaching a client prescribed a clonidine transdermal patch, which statement shows a need for further instruction? The options are A. I can wear this patch while I shower. B. I should keep this patch on for 5 days. C. This medication may make me drowsy. Or D. If I have to get an MRI, I will remove the patch first. The correct answer is option B. Clonidine patches should be worn for 7 days before replacement. Option A is correct because bathing does not interfere. Option C correctly identifies sedation as a side effect. And option D is correct because the patch contains aluminum and must be removed before MRI. NCLEX Pearls. Clonidine patches are effective for adherence, but sudden discontinuation can cause rebound hypertension. Always taper when stopping. Now question 64. In a group of 4 clients, the nurse must decide who to assess first. The options are A. Client on mechanical ventilation with a low-pressure alarm sounding. B. Client with a new colostomy refusing care. C. Client with acute glomerulonephritis and periorbital edema. Or D. Client with atrial fibrillation and an irregular pulse. The correct answer is option A. A low-pressure ventilator alarm signals possible disconnection, cuff leak, or circuit break, all threats to airway and breathing that require immediate action under the ABC priority framework. The other cases, while important, do not pose an immediate life threat. One look on Stancoast Pearls. Low-pressure alarms point to leaks or disconnections. High-pressure alarms mean obstruction or increased resistance. Always assess the patient first. Switching gears to question 65. For a laboring client with a prolapsed umbilical cord, the most likely fetal heart rate pattern must be identified. The options are A. Early decelerations, B. Variable decelerations, C. Late decelerations, or D. Normal variability. The correct answer is option B. Cord compression in prolapse causes abrupt, variable decelerations and can lead to bradycardia, a true obstetric emergency. Early decelerations are benign and linked to head compression. Late decelerations signal utero-placental insufficiency, and normal variability is not expected during acute compromise. C. NCLEX Pearls. For cord prolapse, call for help, relieve pressure on the cord, reposition mother, give oxygen, and prepare for emergency delivery. Moving our attention to question 66. When administering mannitol, the nurse must select the correct IV tubing. The options are A. Microdrip, B. Filtered, C. Vented, or D. Non-vented. The correct answer is option B. Mannitol may crystallize at cooler temperatures, so filtered tubing is required to trap crystals and prevent embolization. The other tubing types do not address this safety concern. Here is Stancoast Pearls. Warm and inspect mannitol before use, monitor for fluid shifts, and check electrolytes closely. Now, question 67. A client on a sodium-restricted diet needs guidance on seasoning choice. The options are A. Soy sauce, B. Ketchup, C. Fresh rosemary, or D. Steak sauce. The correct answer is option C. Fresh rosemary adds flavor without sodium, making it ideal for cardiac or renal diets. Soy sauce, ketchup, and steak sauce contain significant hidden sodium. C. Stancoast Pearls. Herbs, citrus, garlic, and pepper are excellent low-sodium flavor enhancers. Warn patients about hidden sodium in condiments. Here is question 68. For untreated neonatal jaundice, the possible complication must be recognized. The options are A. Sepsis, B. Hypothermia, C. Kernicterus, or D. Pneumonia. The correct answer is option C. High levels of unconjugated bilirubin can cross the blood-brain barrier and cause kernicterus, leading to irreversible neurological damage. The other options are unrelated to bilirubin metabolism. NCLEX. Pearls. Prevent kernicterus with early bilirubin checks and prompt phototherapy. See this question 69. In delegating between an RN and LPN, the safe client for the LPN to manage is considered. The options are A. Acute compartment syndrome awaiting surgery, B. Cystic fibrosis requiring morning sputum specimen, C. Acute respiratory failure on high-flow oxygen, or D. Sepsis on IV antibiotics and vasopressors. The correct answer is option B. Collecting a sputum sample for a stable chronic condition fits within LPN scope. The other clients are unstable and require RN-level assessment and intervention. Stancoast. Pearls. Stable and simple equals LPN. Unstable and unpredictable equals RN. Next question. 70. While supervising a student giving ciprofloxacin eye drops, the correct technique must be identified. The options are A. Tell the client to squeeze eyes tightly after drops. B. Place drops directly on the cornea. C. Place drops into the lower conjunctival sac. Or D. Position client in left lateral posture with knees bent. The correct answer is option C. Instilling into the lower conjunctival sac ensures safe, effective delivery without corneal injury. The other techniques either reduce absorption, risk injury, or use the wrong position. NCLEX pearls. Sac, not cornea. Aim for the conjunctival sac, avoid contact with the dropper, and close eyes gently after installation. Next question. 71. When assessing a client for possible bipolar eye disorder, the nurse must choose a laboratory test to rule out medical causes for mood changes. The options are A. Thyroid stimulating hormone, TSH, B. Complete metabolic panel, C. MP, C. Hemoglobin, A1C, HbA1c, or D. C-reactive protein, CRP. The correct answer is option A. Thyroid disorders, especially hypothyroidism, can mimic depression or bipolar symptoms. So checking TSH ensures that reversible endocrine causes are excluded before assigning a psychiatric diagnosis. CMP, HbA1c, and CRP are not standard screening tests for mood disorders. NCLEX pearls. In mental health assessments, always test before you label. Rule out treatable physical causes first. Continuing with question 72. Parents of a child newly diagnosed with asthma are being educated. The nurse must decide which topic to teach first. The options are A. Proper use of a peak flow meter, B. Warning signs of an asthma attack, C. Importance of staying current with immunizations, or D. Available community asthma resources. The correct answer is option B. Recognizing early signs like chest tightness, wheezing, rapid breathing, and accessory muscle use is life-saving and takes priority over long-term management. The other options are important but do not address immediate crisis prevention. NCLEX. Pearls. First teach danger, then teach daily. Acute emergency signs always come before routine education. See the next question, 73. During a home visit, the nurse observes swaddled bathing of a newborn. The options are A. Removing the entire blanket before bathing, B. Using mild soap, C. Bathing in a warm room, or D. Washing and drying one part at a time. The correct answer is option A. Swaddled bathing keeps the newborn wrapped, uncovering only small areas at a time to prevent heat loss. Removing the blanket exposes the infant to cold stress. The other actions are correct and promote comfort and warmth. NCLEX pearls. Warm water, warm room, warm baby. Always keep them swaddled and never leave them unattended. Now, the second last question. 74. While teaching proper walker use, the nurse ensures the top of the walker is positioned at the right level. The options are A. At the side of the body, B. Even with the wrist crease when standing, C. Allowing 90-degree elbow flexion, or D. Leaning forward. The correct answer is option B. When the client stands inside the walker with arms relaxed, the top should align with the wrist crease, allowing a slight 15 to 30-degree elbow bend for safe ambulation. The other positions either impair stability or increase fall risk. NCLEX pearls. Use the wrist crease rule. Slight elbow bend, upright posture, and walker height aligned to the wrist crease. Question 75. Finally closing this session with antepartum testing, the nurse identifies which result needs follow-up. The options are A. Negative contraction stress test, B. Reactive non-stress test, C. Normal fetal heart rate, or D. Positive vaginal culture for Group B Streptococcus, GBS. The correct answer is option D. A positive GBS result between 36 to 37 weeks means the mother needs intrapartum IV antibiotics to prevent life-threatening neonatal infections. The other results are reassuring and require no urgent action. NCLEX pearls. Positive GBS equals positive action. Always plan for prophylaxis during labor to protect the newborn. Thank you. See you in practice test 29.